Good morning. Our next session is on unintentional injury. I'll let the panelists come and join us. I'm not sure where Ms. Ross is, if she can join us. Come on up and join us. My name is Mary Aitken. I'm a pediatrician. I'm the chair of the Department of Pediatrics at the McGovern Medical School at UTHealth here in Houston. I am also an injury prevention epidemiologist. And it's my real pleasure to be here today and to share all this vital information with you about unintentional injury. For this session, there are 3 speakers, and we'll let them each present their research and programmatic efforts in this area. And following the 3 talks, we'll collect the cards that are on your table that look like this if you have questions, and we'll take questions as a group. So our first speaker this morning in this session is Dr. Sandra McKay, one of the co-conveners today. Dr. McKay is a non-resident fellow here at the Center for Health and Biosciences at Baker Institute. She's an associate professor in the Department of Pediatrics at McGovern Medical School, UTHealth, Houston. A practicing general pediatrician, Dr. McKay's research focus is on innovative programs in injury prevention education, and particularly around firearms injury. And she is a strong advocate for children's health in a variety of areas. Please welcome Dr. McKay.
Thank you so much for having me today. I obviously have no relevant financial disclosures. We're going to go over a review of the need for education on safe storage counseling with our healthcare providers and understand a little bit of the patient preferences on receiving safe storage counseling and reflect on some of the opportunities that we have for novel partnerships in firearm safe storage. We all know why we're here today. This crossover from motor vehicle accidents being the leading cause of death in children to firearms has been something that we are all deeply concerned about, and that's why we're here. What we know about parents is that we know that parents do think that pediatricians should be advising about safe storage counseling within the clinical encounter, and only a small percentage of parents would even firearm-owning parents would even be offended if we had advised them to remove the firearms from their home for safety purposes. But only a small percentage of pediatricians actually do routine counseling on safe storage, and only even more rare pediatricians will actually provide safety devices during the clinical encounter. So why is this the reason? Because we have a consistent lack of comprehensive education at the undergraduate or graduate medical education level. At the time of the Parkland shooting, there were only 2 medical schools in the country that were doing any kind of education on gun violence. And I'm proud to say that McGovern Medical School was one of those 2 schools. And currently, there's only about 1/3 of pediatric residency training programs that offer any kind of formal firearm safety counseling. And when you talk to pediatric residents, only about 50% do any kind of routine counseling on safe storage. And they report that, they don't have any training, they don't have any time, and they don't want to upset or offend their parents. So, this is something that we can definitely help and intervene with. So what we developed with at UT was a 2-hour live workshop that we did. Initially, we incorporated within this workshop a live presentation from our campus police about firearm safety principles, which we later adapted to a video presentation that I did with my personal firearm. And then we also incorporated epidemiology and firearm safety counseling, and then did these role-playing scenarios to allow the resident to develop some skill-building session on how they could do counseling with their patient and with their families. And what we found was, in general, residents don't own firearms. They don't have a lot of background with what firearms are, and so they felt very uncomfortable with even addressing those conversations. And overall, after the workshop, we saw a significant increase in their comfort in asking, discussing, and even believing that it was an effective intervention. And what you can see here is looking at the blue line, because this is kind of a busy slide. Blue line was before the workshop. And then we looked at intervals at immediately, 3 months, and 6 months after. And you can see that at all points afterwards, we saw that they all surpassed the blue line in their self-comfort on asking, initiating conversations, and viewing as effective interventions. And even 6 months after the workshop, residents were 5 times as likely to counsel about firearm safe storage. So if you train people, they can they're educated, they'll learn, and you can have good interventions. And what COVID did was it gave us this wonderful gift to be able to implement this workshop in a virtual platform, because I have to look at the silver lining when we can have it. So we utilized our partnerships and leverages with UT Southwestern and was able to see how we can implement this on a virtual platform and compare it to what we did here at UTHealth. And what we found was with our firearm safety counseling patterns, we saw this shift where you can see here in blue was what the reports were at 6 months after at UT, and you can see that the pattern of rarely counseling 6 months after the workshop, you see that shift happen where they were reporting they were rarely not counseling where they were rarely counseling not counseling at that 6-month mark. So we saw that pattern was very similar between the UT and the UT Southwestern program, showing that our intervention did work. So that virtual versus the in-person was very similar in our results. So it was very promising to us. We were able to expand this workshop to both not only pediatrics, but also to other specialties as well, internal medicine, psychiatry. So this is very exciting for us as an organization. And also we were able to develop partnerships and leverages to take the framework of this and collaborate with Vanderbilt University to create a completely asynchronous platform as well. So this platform was used for this program called SAFER, which is available through the American Academy of Pediatrics in a collaboration with Vanderbilt, and I serve on the steering committee in the development of this. And this is another opportunity for people to become educated on how you can provide safe storage counseling. But as we're educating ourselves on having these more competent relationships with our patients and talking and screening, it got us thinking, what do our patients and parents really want to hear? And so we surveyed our patients. And so looking at our pediatric clinic population, this is our primary care pediatric clinic that's across the street over at UTHealth, where we service about 4,400 well-child visits annually. It is a primarily managed care Medicaid clinic where we have about 83% of our patients are managed care Medicaid. We predominantly service patients that are low socioeconomic status. A lot of diversity within our clinic where 55% of our patients are Black, 25% Hispanic. And what we asked them was a 22-question survey where we asked them a bunch of questions. Gun ownership, what do their current safety storage practices are. We asked them a lot of questions about their risk perceptions, and you'll hear a little bit more about that from Dr. Hafiz in a little bit. We also asked them about who their preferred messengers were, and we saw some of these wonderful responses here. And what we found was when we asked them, should the pediatrician provide firearm safety counseling at the well visit? And it wasn't a slam dunk. So you can see here the questions were really kind of mixed. And when we look at the strongly or somewhat agree here in blue, it's about a little over a quarter of the patients that were strongly agreeing that the pediatrician should be talking about it. And about 37% of the people were strongly or somewhat disagree. So it really got us thinking, who do they really want to hear from? And so that was one of the other questions that we had. And the messengers that they prefer to talk to about safe storage were family members, law enforcement, and firearm retailers. In fact, doctors were like the last one that they had ranked on this list. So that got us to surveying our firearm retailers and asking them, who are they talking to about this? This is like, we know what law enforcement is saying because we hear their public service campaigns, but we don't really know what firearm retailers are talking to their customers about firearm safety. So we asked them. And so within our survey that we did, we talked to a total of 85 ranges and retailers in the greater Houston area. We asked them initially, what safe storage devices do you sell along with the safe storage device that typically comes with the firearm purchase? And we found that in general, locks and safes are the preferred device that is sold with on top of what comes with your typical device. But what we also found was that retailers and ranges, by far the majority of them, provide additional safety information above what is typically provided with point of sale, right? All firearms handgun sales have to come with the ATF child safety handout. And everyone says that most everyone says that they provide additional firearm safety counseling. But the variability is wide. So what we'll find is retailers like to provide additional handouts. The most common one that they reported was the National Shooting Sports Foundation handout that they like to additionally provide. But then there's also several that do a lot of additional verbal counseling. They said that they will talk to their customers, ask them what they are preferring to do. They said they'll talk with them about scenarios, may talk with them about hunting, and they'll go through a lot of various different things that they'll talk with them about, as opposed to ranges, which will tend to refer them to a variety of different classes. Additionally, 20% of them reported providing suicide prevention materials as well. So that got us thinking about opportunities for collaboration within our community. So we identified this gap of not having consistent messaging around safe storage, especially when we're looking within our community, as well as finding this trusted messenger concept of maybe the patient's not really wanting to hear all these messages from us in that healthcare setting. And honestly, they're coming to us once they hit age 3, they're only visiting us once a year anyway in the primary care well child visit. Are there other opportunities for us to engage within the community? And then trying to find that right partner with us as far as who can we collaborate with in the community and how do we build those bridges. And what we did was we were able to secure a grant with the Safe States Alliance and develop a relationship with the local firearm range, the Texas Gun Club, to develop a program where we could reduce firearm injury by promoting safe storage counseling efforts at point of sale. And so what we've been doing is a series of qualitative interviews with all of their retailers at all points of contact, whether it be the president of their organization, all the way to the person who is hitting the button at the customer cashier counter line, and looking at their knowledge and attitude around providing safe storage counseling at all the various levels of contact that they have, whether it be the gunsmith, the range handler, whoever's providing their classes, looking at their barriers, effectiveness, ease of integration, and whatever resources that they may provide. And we've learned a lot of information as we've been conducting our interviews, and a shout out to my team collaborators, Mike Garcia and Kate Vangetelina, because they've been a great team as we've been collaborating and learning all this really rich qualitative data. And so some of our preliminary results as we've been continuing to kind of weave through these hours and hours of data and interviews that we've been doing is the first thing that we're learning is language matters, right? So we've been developing this kind of almost data dictionary. So what we've learned is there are certain terms and terminology that are really important for the firearm retailer. So one of the first things that came out is like the word firearm is important. So the preferred term is firearm and not gun. So when they're talking in that encounter, in that space, we want to use the word firearm and not gun because that's really important for them. And then other themes that have emerged are this kind of idea of reframing the concept of dangerous, right? For the firearm retailer and for most firearm owners, especially if it's where they're in the business of having their firearm for, like, you know, if they're a law enforcement or if there's something that they're using their firearm on a regular basis, they're not seeing their firearm as a weapon. They see it as a tool, as something that they use on a regular basis. So if you're using messaging on safe storage as, hey, that's dangerous, you need to lock it up, it's not going to resonate with them because they're not seeing it as something that's dangerous. So using that danger mechanism in your messaging is really not going to be as effective for you, right? And so maybe you need to reframe how your messaging is when you're thinking about that dangerous concept. The time is there. They spend a lot of time with their transactions because they want to make sure that the person, the customer that they're serving is actually purchasing the right firearm for them, you know, and they actually went through and discussed, you know, that they spend a lot of time with their transactions. They don't want the customer to not buy the right firearm for their purchase either. So, you know, they have a lot of time during these transactions. There's a lot of time that they're spent, you know, going through the background checks. So they have time. They feel like doing this type of program is something where they could incorporate safe storage counseling within their procedures because it's not a rush transaction. You're not going through an express lane checkout when you're doing these kinds of things. There's adequate time for them. But they also commented on the resources. They commented that some of the handouts are really poor, they're very wordy, a lot of legalese within them, and there might be some opportunities to improve some of those resources that they could have. They do feel like they're the experts on firearm safety. They're the experts on firearms, so they feel like they could really, you know, speak safely on safety, and that they feel like they could really, you know, take ownership of that. They felt also that this might be a space to discuss something around, you know, suicide prevention. However, they did feel like they had some concerns on that because they're not trained to recognize red flags on mental health, but would ask, if that was something that they could maybe explore some opportunities for learning about these red flags. Because, hey, people are coming there to buy firearms. Firearms are dangerous to some people, right? And so it would be important to learn about these red flags on mental health when they're purchasing them so that they could become more equipped on this. And finally, we learned that they want to be involved. Actually, some of the first things that I heard was like, hey, no one's ever come to us before. Why hasn't anyone ever come to us before? We really want you guys to become talking to us. This term was thrown around a lot of the almighty academia is sitting up there in your ivory towers making decisions without involving us before. Why haven't you guys come talk to us? Because we deal with this all the time, and we know firearms. We sell them. We deal with them all the time. Why don't you guys get us involved? Because we are players. We're in the same field here. And also the idea of giving each other shared credibility, because the message that I give into the clinical encounter when I say you should lock up your guns becomes much more credible when the firearm retailer also gives that exact same message. So having that shared and unified message can give each other credibility, especially when we're discussing that with a patient and trying to improve safety. And then we also have had they've shared really rich personal stories on their experiences during those firearm sales when they've said, we really had to, deny sale to someone because of, they gave us a lot of really rich personal examples, which, as we continue to do our data analysis, it's going to be really exciting for us as a team. So in conclusion, when we look at firearm safe storage counseling, it's really important that we find the right language in order to develop that right messaging. And that messaging should be consistent across multiple areas, healthcare, law enforcement, and our retailers, so that we can continue to develop our educational priorities and disseminate that across multiple platforms, and how we can develop an incorporation of safety device distribution so that way we can amplify our messaging throughout all of our clinical partners so that we can have that ideal platform. And I just like to display this pin because this is my very favorite messaging that's come across the American Academy of Pediatrics, because it's clear, consistent, and concise. And how we can do that within firearm safe storage counseling, I think, will be the best thing that we can do. Thank you so much for your time.
Thank you so much, Sandy. Continuing the theme of how we can help families avoid unintentional shooting injuries in their family, I'd like to welcome Dr. Zoaib Hafiz. He is presenting on temporary emergency storage options and parental risk perception. Dr. Hafiz is an assistant professor at the McGovern Medical School Department of Pediatrics and is a pediatric hospitalist at Children's Memorial Hermann Hospital. His research focuses on geospatial analysis of public health issues, including unintentional injury, transportation injury, and gun violence. Welcome, Dr. Hafiz.
All right. Hey, everyone. Thank you for having me. Let me just experiment with this real quick like everyone else does. So this and then this. Okay, thanks, everybody. I have no disclosures. So for this talk, I'm just going to speak briefly about 4 core concepts that we'll get through, 4 core objectives. One is we'll talk a little bit about parents' perception of their children's risk of firearm injury in whatever community they live in, both in the academic literature as well as locally. We'll compare those perceptions against what we're actually seeing out in the area, the Houston area and Harris County, in terms of where actual pediatric firearm injuries are affecting communities. We'll talk about temporary storage as an option to offset some of that. And finally, we'll talk about some potential predictive metrics that could identify areas at risk for future pediatric injury. So first is risk perception. There's not a whole bunch out there in terms of academic literature. In fact, one of the major articles is written by Dr. Aitken, or led by Dr. Aitken, published 2 years ago. And one of the quotes that stood out to me in that article was the second bullet point, which is, "I am more worried about snakes in my yard than the guns in my home. So when kids come over to play, that's what I say, watch for snakes." So it's common for firearm owners to talk to their kids about gun safety, but maybe the perception of risk for their children isn't there, which is not surprising and not unusual. So what about here in Houston? So this is Dr. Aitken's study that she was referring to in her talk. The question on the left is, can your child access firearms? Of the 36 people that owned firearms in the study, 100% said no, they can't access it. But if you look to the right, one of the questions was, or a series of questions asking, do you keep your firearm unloaded? Do you keep your firearm locked? And only about a quarter of the people asked, of the 36 people asked, answered that they did both those things. From the same survey, when it comes to safe storage, is money a factor? 96% of the 73 people who answered said no. But when asked, do you know what to do if you had to remove your firearm from your home for safety? About 40% said they wouldn't know. This question was a very interesting question, which we'll keep going back to during the duration of my talk. And they effectively asked, 122 respondents asked, do you believe your children are at risk of gun violence? And they had 5 different options, and you could see that overwhelmingly it skewed to the not at all side. In fact, over 80% said either not at all or probably not. And we'll map out where in Houston these answers are in just a moment, so keep that in your head. Then there's the actual pediatric firearm injuries. This data is from Dr. Levine, who noted that of the 3 major pediatric trauma centers in Houston, which is us at Children's Memorial Hermann Hospital at UTHealth at Houston, Texas Children's, which is affiliated with Baylor, and Ben Taub, which is affiliated with Harris Health, they see about 160 kids a year. The data set that I'm about to present comes from Children's Memorial Hermann Hospital, TMC, and we see about 50 a year. We're going to map about 105, or exactly 105, but for the years 2019 and 2020. And I apologize, the actual ages are the same for both Dr. Levine's data and our data, 0 to 17. So this is what we saw. Just to orient you guys, let's see if I can figure this out. I'm not going to get that. So very quickly, you can see that right in the middle, that deep red area is 77004. That's 3rd Ward, Museum District area, just to the east of us right here. They saw the most firearm injuries. And you could see, just to kind of orient you, it's center out to the bottom right where the legend is. That's Galveston Bay. You can see I-10, 610, Beltway. You're essentially looking at the greater Houston area. I'm going to try one thing. I'm going to try to touch it. No, it didn't work. Okay. So I'm not going to figure out the pointer, so hopefully you guys can get a little bit oriented there. And I'm going to show you a different map. This is the risk perception in firearm owning families. So when they were asked, are your children at risk of gun violence, if you see a light yellow, that means there was 0 to 1. Not at all at risk to probably not at risk. And let's overlay these 2 maps. And just for context, this was 122 respondents. This is the overlay of those 2 maps. So again, this is that map of are your children at risk of gun violence, and what we did was if that particular zip code had a pediatric firearm injury that it came to our ED, we put hash marks on it. So I think most of us are probably from the Houston area. Point at the screen. I keep trying to do that. I can't do it. Oh, I figured it out. Excellent. Okay, so. But I have to turn my head away, so I don't think I'll do it. So, but what I'll say is a couple of things that stood out to me here. One was, if you look at the south side of the loop, where 3rd Ward, what's right, Old Spanish Trail, Sunnyside area, from the loop all the way down to the Beltway, you see a grouping of pediatric violence, pediatric firearm violence. And you see variations in perception. Some places think they're safe, some places maybe inaccurately, some places realize that like 77004 thinks they're safe, but they actually have a very high pediatric firearm violence rate. Same thing's true with the northeast of Houston. That's where Trinity Gardens is, the neighborhood of East Houston, San Jacinto Community College's North Campus is out there. Same thing. They have maybe a incorrect perception that their children are safe from firearm violence, but we're seeing a lot of kids come from there. And then the I-10 corridor towards the west. If you're driving towards Katy and you're outside of the loop inside the Beltway, you look to your left, it's a very diverse area of West Houston. They have that similar potential misperception, and even out in Katy, you see a lot of gun violence events with a perception that their kids are not at all at risk. So what are some options? One is temporary storage, which Dr. McKay alluded to. What is that? It's a simple concept. Firearm ranges and stores that could temporarily store your firearms for a small fee. This was originally created by the Colorado Firearm Safety Coalition. With a focus initially on suicide prevention, they created this really cool map that is publicly available for the residents of Colorado. And they're collaborating with our team here in Houston on both research design and strategic planning. So our team here identified 161 stores and ranges, and 21 already offer temporary storage options. Storage typically fees range from $8 to $40, so not too expensive. And if you remember our initial survey, expense wasn't really a big roadblock. It was really knowledge of where I can store my firearms. So why do temporary storage? Well, one thing is maybe you have a teenager or another person in your household who is in crisis and at risk for suicide, and you know it. You're knowledgeable about it. You know that your family is going through a tough time, your household is going through a tough time. You just need the ability to put your firearms somewhere safe. And maybe you don't typically have a child in your home. Your grandkids are visiting, and they're coming in for a couple of weeks, and you don't have a safe place to put it while they're here. I will tell you, I'm a pediatric hospitalist. We are absolutely seeing a mental health crisis. Things that I saw once every 5 years, I'm seeing once every 2 months. For example, children, preteens trying to harm themselves, or accidental injuries. This is absolutely something that could be a resource for those kind of families. A lot of times it doesn't come out of the blue. They knew that their child was at risk. Here in Houston, the Department of Pediatrics Population Health Initiative at UTHealth at Houston has been working with firearm ranges and stores to create a centralized database of temporary storage facilities, and very exciting, here's a sneak peek. They're about 2/3 of the way done. They're going through 1,800 ranges in the state, and you can see that they've identified a whole bunch of places all throughout the state. But let's look at the greater Houston area. This is our map that we were looking at before, a little bit zoomed out. And you can see that there are, those black dots are temporary gun storage facilities that are already offering the service. You can see all the way up to Conroe and the Woodlands there are options, down to Clute, Lake Jackson where I'm from there are options. I think that's Hempstead in the northwest, all the way down to Pasadena. And a whole bunch of places in between. We can zoom in a little bit closer to that original map that we were looking at. And you can see that that I-10 corridor is pretty well served. It might just be a question of education and getting those parents aware that hey, look, your neighborhood might be at risk and there are options for you. There's opportunities to improve that northeast corridor where East Houston and Trinity Gardens is not well served currently. And that hot spot in South Houston where Sunnyside, all the way up to 3rd Ward is also a place that there's an opportunity to work with maybe local clubs and ranges. So what are some next steps? Well, what if we could identify some of these areas as at risk before pediatric gun injuries actually occur? The first question is, do national level studies apply? What are the variables? And one variable that's been brought up before by Dr. Naik and Dr. Levine is the potential for poverty being associated. And there was hot off the press from JAMA Pediatrics, a journal of a medical association, Pediatrics section, had an article published this year looking at the national level study and looking at different counties throughout the country. And essentially what they found was the higher the poverty concentration of your county, the more likely that county was to have pediatric firearm deaths of all causes, accidental, non-accidental, whatever. And this was after correcting for a whole bunch of stuff, demographic factors, including gun prevalence in your state. So this is the poverty rate in Houston. I'm sure a lot of you guys have seen this map. This is from Harris Health. And you could see that, East Houston, including the inner loop, is affected, and North Houston outside of the loop, between the loop and the Beltway, is affected, and a bunch of other places. And this is our firearm injury map. Now, I'll give you a couple of caveats. One is this, so this is the home addresses on the left. These are the home addresses, the homes of these children that are getting injured and killed by firearms. And we're still early, it's only 2 years worth of data, but I don't really see much of an association. It doesn't line up like I thought it would when I started putting this together. So maybe we can dig a little bit deeper. The CDC has a social vulnerability index. The social vulnerability index is a whole bunch of variables, which you can see on the right column, that they grouped into 4 major themes to try to identify neighborhoods and counties and areas that are higher risk for social vulnerability. Poverty is one of them, but there's a whole bunch of other ones. And when you look at the overall social vulnerability index score, it looks pretty similar to the poverty map, which shouldn't be a surprise. But they have 4 different themes. And the question is, maybe do one of these themes and even a subset of these themes, could they help us identify these different neighborhoods that might be at risk? And I'll save you the trouble. One of the themes seems to correlate to some degree. This is the household composition theme. This theme is made up of 4 variables. This theme is made up of proportion elderly, proportion of children, which absolutely maybe the issue is just, if you have a lot of children, you have a lot of children at risk of gun violence. I don't know if I buy that, but it's possible. Proportion of disabled in your community and proportion of single-family households. So what are some lessons for future study? Is there an association maybe with one of those variables or some other variable that we're not even thinking about, or variables that are in the literature and we just need more data on, that can help us predict using machine learning and other options to figure out where we can use advocacy, work with community advocates and other groups to identify neighborhoods in the Houston area before they reach epidemic levels. One is, and this alludes to Dr. Naik and Dr. Levine, is it maybe, Dr. Levine's done a great job on this, combining the data sets for Texas Children's, Ben Taub, and us, to create more complete data sets and to engage in machine learning with those data sets. Understanding our limitations. We're still early in collecting data. COVID, Dr. Levine, I keep referring to his talk, he's talking about an increase that occurred start before COVID, but I will tell you on the ground level, something happened with COVID with kids and mental health. Absolutely. Nobody's going to convince me that's not true. I don't think we know what's going to happen in the future and how our data sets are going to change as time goes on. And finally, this offers the opportunity for local level dialogue, education, advocacy, and interventions. Thanks, guys.
Thank you, Dr. Hafiz. Our final speaker in this session on unintentional shooting risk is Lisa Ross, who will be speaking about community-based safe storage interventions that work. Ms. Ross is the founder of Lock Arms for Life, an organization dedicated to ensuring all gun owners use and store their firearms safely. A mother of 3, she lost her oldest son, John, to a handgun-related unintentional shooting in 2009. Since then, she served as a gun safety advocate and has given numerous presentations and interviews. Ms. Ross.
Show me how to use everything too, because I'm not real suave on this stuff.
So let's see.
I even brought notes because I thought, oh gosh, what am I going to know?
This one right here? The center one? Okay.
Okay, show me how to do it.
I don't think it's projecting onto the...
Nope.
Here we go. Okay, so hit
Okay,
the center
go.
one to go forward.
Okay, so how do we go back? Bottom one?
Bottom one, there you go.
Okay, so center one forward, bottom one back, right? Okay, so we're going to start right here. All right, as you can see today, I'm going to talk to you about life, death, and gun safety. Again, my name is Lisa Ross, and first of all, I want to thank everybody for inviting me and having me here. We're all doing really great work, and I'm so proud of some of the research they've done. Some of this is all new stuff to me too, so for what I learned, it's really awesome. You'll see my challenges that I've had as I've gone forward in learning how to navigate this world of guns. So anyway, first of all, again, I'm the founder of a program called Lock Arms for Life. It's an educational program, and I've given this talk to audiences. I've given it at PTA meetings. I was giving it at church groups, and I've given it to Safe States Coalition, and I've given it to high school students. Our mission is pretty simple. We educate our community members and our really just all our community members about safe gun storage and safe practices to save lives. Like many of you, what we're trying to do is just change the narrative about gun safety. Again, as this one goes on, I can see I've got little notes here too, but I'm going to use my own because I'm kind of used to it. Anyway, these are my 3 sons, Keaton, Lance, and John. John, my oldest, is on the right. He's the one that died. This picture was taken in 2009, about 2 months before he passed away. My youngest one that's in the photo right now is 27 years old, so that kind of tells you an age frame of how long ago this was, about 12 years. What I want to say now is that we were living in Austin. We lived in Austin at the time, but John, my two oldest ones, ended up deciding to stay behind in North Carolina. And John was going to community college there, and he was studying kind of some of literature and was working on his degree. And he it still gets kind of difficult for me to even talk about it still today, to be honest with you. So anyway, my husband, it was his birthday, and my husband decided to go up to the North Carolinas and visit with my son. And also he had brought a friend with him that he was going to take on the trip who had never seen the Carolinas. So they go up to North Carolina, they check on our dealership that we had up there at the time, and he's doing the showing golfing and doing the things for his birthday that any husband would do. And they go and have dinner that night with my son. Afterwards, they go over to a family friend's home that he was staying at. And John was kind of texting back and forth that night, to people back and forth and talking to them. And my husband was like, kind of, what's going on? And he goes, oh, I'm going to go meet up with a group afterwards. We're going to go over to see this local venue, and we're going to see this hip hop performer that's performing over there. So, and he was, like I said, and even back then, texting is not like it was today. You got these old time flip phones, and that's kind of how you were texting back then. So I have a log, even that afterwards, after he passed away, I have all the information of all the text messages that were going throughout the night. So he goes and sees the hip hop performer, kisses his dad goodbye. I talked to him about an hour before he left. Like any mom, even though he was like 23 at the time, I still said, please give me a text message when you get home. I just wanted to make sure that he was home safe and sound that night. He lived on kind of a windy hill. I don't know if y'all have ever been to the Carolinas, but it was September too. The air was beautiful and crisp that night. The leaves were starting to change. They were, the reds, the yellows, and the golds that you see along the Blue Ridge Parkway. So it was just, a beautiful evening. Anyway, he goes over to the venue that night. He is there. And then goes over to friends afterwards, like a lot of young adults do. They're still ready to keep going on. They go over to a friend's house afterwards. He goes over to the friends, and sitting on the coffee table is 2 firearms. One of the firearms is fully loaded with a bullet in the chamber. Someone hands the gun to my son. The reason why I know this is because we still never even read all of the statements from the kids, because it's still an ongoing investigation. Not an investigation that meaning that there is something that bad that happened. It was an accident. It wasn't meant to happen. But that if we could ever prove that there was something of negligence going on, then we could go back and reopen the case, and then we could go back. But according to the autopsy, my son is left-handed like I was, just like I'm holding this clicker in my hand. But for some reason, that firearm was in his right hand. He had his finger laced through the trigger. It was pointed towards him, and it discharged, and it killed him. Now, that gun shouldn't have been out. That gun should have been stored safely. They should have had the education and the knowledge to know that that's not what needs to be done. And so I decided afterwards that I wanted to start doing something, but I wasn't sure what I wanted to do. When I educate young adults, especially high school students, this is the picture I have in my slideshow. And I have this in the slideshow for one reason and one reason only, because this is how I visit my son now. This is what it really looks like when you lose a child, and this is where you go to visit them now. So there's no more of that, having those nice conversations, text messaging. This is what my life looks like when I visit him. And I heard recently, I don't know, I'm sure many of you guys heard the press conference that Matthew McConaughey gave, and where he talked about the fact that those families were in Uvalde just wanted to give meaning to their children's lives. And really that was it for me, is that so resonated with inside of me that I knew that I just wanted to give meaning to my son's life. And so that's when I started, what am I going to do that? And that's what I've been doing for the last 12 years. So at first I started writing a book, and I started with a real simple book. I brought it with me actually so y'all could see. But it was a chapbook, because like I said, my son was an artist, and he was a painter, and he did a lot of poetry. And so this was all his artwork and poetry and all that, and I started putting it together. But it never felt completely finished. So what I decided to do is I got with a writing coach, and I wanted to make it into a book. I pitched it to the University of Texas Tech University, and they decided to take on my project. And they ended up being my publisher, and I was published in 2020. And again, it's called At Close Range. So, and this is another one I put in my slide presentation because I want people to know that we do own firearms. And I heard Sandra talking about the fact that you have to connect to your audiences and who you're talking with. And when I first started this, I wasn't sure if I was really connecting with my audiences because I was originally when I did this, I started into advocacy. I guess really what kind of turned that corner was getting into Sandy Hook. When Sandy Hook happened, I knew I just couldn't sit on the sidelines any longer, and I knew I had to be involved, and that's really what catapulted me into being an advocate. But, and so I started with a program that was called Be Smart, which is Every Town for Gun Safety, and I started educating, but I wasn't being able to get into schools. I wasn't able to be able to, and it was very structured on that I could not tailor the program to just talk to everybody. All I could do was I had to talk to parents of young children, and I had to follow kind of what their program was and the presentation and slideshows. And I wasn't getting around. So I decided to tailor the program, and I ended up putting this slide inside there. And all of a sudden, doors started opening up because you know what? I was one of their community, and they knew that I was there to really, I wasn't there to take their guns away. I was there to really share a message about what my tragedy, what happened, and safe storage on top of it. So at the time, like I said, I was kind of getting this, but every town was not happy with that they didn't want me to have slides with, you know, a deer and a shotgun or a rifle inside of with my son pictured like this. So I was kind of getting pushback for them, and I was getting this pushback from the gun community because they didn't at first accept me, so I had to find ways to be where my credibility as part of one of them so that I could talk to them about safe storage. And the other thing was, the most important thing to me at the time was that I wanted to make sure that I was educating young adults. My son was a 23-year-old son. The people inside that room were between the ages of 18 and 23, and I wanted to make sure that those people, because were our future gun owners, that we're getting the education out there to them, and so that was very important to me as well. So I decided, you know what, if I'm getting all this pushback anyway, I might as well just develop my own program. So that's what I did. So I came up with my own, which is called Get Active for Firearm Safety. And again, I educate young adults, I'll educate community members, I educate just about anybody out there who is. And so I'm going to kind of go over some of the pillars of what this is. If I'm giving this to like a group of high school students, this is kind of how I would educate them. So the A are acronyms. I mean, sometimes I don't say that word right, so I sometimes say they're pillars because it's an easier word to use. But the pillars of what I advocate for. So the A is, for example, always securing guns in homes and vehicles. Pretty simple. We know that you just lock them up. Safest way to lock your firearm up is locked, unloaded, and separate from the ammunition. You need to use a cable gun lock. You need to use a lockbox. You need to use some kind of a safety device. Same thing with the vehicles. You don't just throw it inside the back of the trunk. You don't just put it in your console on the side of the car. You lock the gun up. And right now, I'm sure, even I'm from Austin, and I know I just heard our chief of police talk about theft is one of the major concerns that they have right now about firearms. Then you talk about cultivating responsible behavior. Cultivating responsible behavior is like knowing what your target is and beyond. Speaking of the National Shooting Sports Foundation, they have a list. Treat a gun as if it's always loaded. Never point a gun at anybody. Those are cultivating responsible behaviors. T is think about the risk of unsecured firearms, or think about the risk of suicide. We heard all the information about suicide, that it's on the rise as well. An unsecured gun, easy access, and firearms are the most lethal means of a suicide. So we want to make sure that we're locking those firearms up because of that. I is inquire about other guns in other people's homes. I mean, that's pretty self-explanatory. If you don't ask, you will not know about guns in other people's homes. So you want to ask simple questions. We tell people, if you own a firearm, not do you own a firearm. If you own a firearm, can you tell me how that is stored? We also tell if it's a babysitter and your kids are babysitting age and they're going over to people's homes to babysit, put it on the checklist. It's no different than asking about swimming pools in somebody's backyards. It's no different than asking about food allergies. You just want to ask if they have a firearm, how are they storing it? And then voice your concerns about gun safety. If we don't talk about it, we're not going to get the message out there and nobody's going to know. And finally, you want to educate your peers on the pillars of what I just advocated for. So now what I'm going to talk about a little bit about is that just like everybody else on this, we run into challenges and the message is not simple and we know that. So we know that we have to come up with sometimes some kind of creative ways. But I'm going to tell you a little bit about one of the challenges that you guys might maybe know or maybe don't have any idea about. But about right before COVID, a year or so before COVID, I was approached because I was working with organization Texas Gun Sense and I was working with Safe Kids Austin. Actually, I'm board members, and so the medical community was starting to reach out to me more and more and asking me more and more questions as well. And so they came across this thing where there was, let me look here because I need to make sure I got my notes right on this one. But I received an email from a group from GTAC, which is the Injury Prevention and Public Education Committee, and they're a section of the Texas Department of Health and Human Services. And so I got this email from them that they were getting pushback, and basically what they wanted to do was put in a simple policy statement about safe storage into their EMS, first responders, and things like that. Simple little statement. And they were being told that they weren't allowed to do it. They were getting this pushback. And it was from a pro-gun group called the Texas Freedom Caucus. And they did not want healthcare to be asking questions about firearms. And so, and then again, simple questions. If there's a gun here, can you tell me how it's secured? So the Freedom Caucus tried to squash the ideas and the questions on gun safety. They were worried about becoming gun prevention. So in this kind, of course, we all know this is lobbying. This is what they were doing. And again, these were simple questions, non-political questions that an EMS responder might need to know, especially if he's arriving at a home of a suicide attempt. You might want to know in that instance if there's a firearm present. So we worked with the Texas government, all the organizations did, and we went ahead and wrote up letters of support, just like you would do on a lot of other policies that you're trying to make sure that they get supported. And we had support from people like the American Academy of Pediatrics, we had the Emergency Nurses Association, and we had the American Trauma Society. All of the groups approved it, all wrote letters of support. But in the face of all of that common sense, we still failed. It was not passed. The government, Texas government, all the way up to the governor's office blocked our efforts. And it was a setback. And a lot of these things are going to be setbacks. I mean, this is what I deal with every single solitary day. So I know I had to come up with more creative ways of getting my messaging out of there. Listen, I'm motivated, and because this is personal to me. I have a personal stake in this, and so I'm extremely motivated on the work that I do. It's kind of like lose a son, gain a mission. And so we've given away thousands of gun locks. I mean, that's one of the things my organization has done. But we need more help, and we really need help from people like you, especially like from you. You're the influencers, you're the advocates, you're the voices that need to be heard. And so we want you to engage your families, your patients, your public, and be proactive about talking about the Get Active and Lock Arms for Life. I was disappointed about the failure that we had on getting that simple policy in there, but I want to tell you that since then, these are my allies. I received a grant from the Austin Public Health Department of Office of Violence Prevention. That's how I can give away thousands of gun locks, because they helped me, funded me. I work with Department of Public Safety. I work with the District Attorney's Office, and I work with Austin Police Department. And we put together a campaign. You're right about the water. You put together a campaign. We put together, it was called Safe Gun Storage Saves Lives campaign. And all of these entities in Texas Gun Sense were included in that. We did everything in English and we did it in Spanish. Here's an example of a billboard that we put up in Austin. As you can see, we did 5 of these in very high traffic areas. You can see the HEB in the background, so you know that everybody going to the grocery store is seeing that billboard. This is also a very high traffic thoroughfare area where we put this one as well. On this, we did, I think about over 5 million impressions is what the total number did with the 5 billboards in Austin, and that was over about a 2-month period of time. Here's another image. We did buses as well, and we put them on the exterior buses. And I got a couple more of these. As you can see, the guy, let's hope he's reading that safe storage. Let's hope everybody that's walking on that bus is looking at this. Here's more people getting on the bus. We did 3 buses, fronts and tail ends, and then we also did these place cards that were inside. And we did 150 place cards. So it was 150 buses that had that safe storage message on the inside of their buses. Of that, we probably got 1.7 million is what they figured the impressions to be on that. So that's how much of an impact that we started to make on our community in talking about safe gun storage. What we also did is we created a simple website. This is the website we did. As you can see, it says right on the bottom, click here to get your free gun lock. So people can just go straight to that website. They get a free gun lock if they want. Again, like I said, we've given away thousands of them. Below this page too, we have I gave each entity a space where they could write a simple blurb, and then they could link to their sites as well to talk about what kind of initiatives they wanted to do. Like the DPS, their Keep 'em Safe Texas program, they could go ahead and do that. So basically, I'm getting to the end of this too. It was crucial to have those partnerships. It's crucial to start developing that so that we can start moving forward and start educating our community. My message again is pretty simple. It can be very controversial. We all know this. It's not something new, but we also know together that we can start making changes. Policy, we can start making changes, just good common sense. And so I'm pretty much, that's about it. That's all I really want to talk about. And I just want to tell you thank you for your time and having me here. I really appreciated it.
Thank you, Ms. Ross. Is this on? Can you hear me okay? For that compelling story and amazing advocacy. We have time. We just have a few minutes for some questions for our panel. And I wonder if people have got the cards to, okay, thank you. Oh, quite a few. Okay, thank you. We have about 5 minutes. Here's a question for Dr. McKay. It's, if dangerous is not the most effective term to use, what is recommended?
So I think when we think about dangerous, and you want to use danger as like a motivating factor to try to get people to lock things up, but instead, some of the things that we want to think about is their firearm is like a tool. So I think of the analogy as like a construction worker who uses their tools, right? And so, they wouldn't leave their tool or like their hammer laying on the table. You don't say, oh, your hammer's dangerous, don't lock it up, but your hammer is a tool that you use in your job, and it's valuable to you, and you know that you don't want it to get lost or stolen. You don't want someone who shouldn't use it to have access to it. So I think utilizing it and reframing your language to think, to look at it as this is what you use in your daily life, right? And this is a tool, this is what you use, but it could cause harm to other people who aren't trained in how to handle it. And so I think kind of maybe backing off a little bit on that like danger, danger, danger word that we tend to throw out because we want to intimidate people, but just taking that language to, yes, it is something that you use it as your tool, and you need to protect your tool from those that aren't trained in it and don't necessarily know how to handle it and utilize it, and think about maybe protecting that tool instead of like utilizing that like danger mechanism.
Thank you, Sandy. Next question, and I may not get to all of these. It's great that there's so much interest, but next question is for Dr. Hafiz. For the Texas Storage Map project, what level of training and support is being provided to the retailers who are participating, and what is the follow-up to track the outcomes for the project?
Probably be a better question for you, Dr. McKay. Dr. McKay is running the show on that one, so I'll defer to you.
So right now we're really just kind of in our formative stages, kind of getting that information with those retailers to learn from them what they're currently doing. And part of our grant work is really to learn what the lay of the land is so that we can develop this training platform for them. So, but we really want it to be a grassroots effort so that we can learn from them what they want and also get their information on what the training needs to be from them, because we know they're the experts in safety and training. So we really want this to be an informed collaborative approach from them.
Thank you. Question for Ms. Ross. You're trying to reach out to a young adult population, and you have a website and lots of traditional media. Are you using social media to get to that group?
Oh, yeah, absolutely. Yes, we are Instagram, Twitter, Facebook. We have all of the platforms out there. I just recently actually hired, because I was doing it myself for quite some time, and I just recently hired a woman that actually takes care of all the social media. In fact, she tweeted about this today, that we're at this conference. So yes, we definitely make sure that we get the message out there as much as we can about safe gun storage. Yeah.
I've tried to tweet about this conference and I failed, so we all have a lot to learn.
We made it. It was in there. I saw it.
Okay,
Yeah, we're getting lots of good responses.
And then maybe a final question, and I'll let you all decide who should answer this. It's difficult. What metrics are used to assess the effectiveness of gun violence interventions and how safe storage interventions work and how effective they are? How can we know?
Metrics.
Yeah. It's difficult because, I can tell you too, I know it's a difficult a question to answer, because I even have this with my grantor, because that's one of the things that when you apply for a grant, they want to make sure that you're not only fulfilling the grant, but that you have a point of measurement. The impressions is one of them. Is for me is to show the impressions, but I do also events where I'm out in the community, and it might be some kind of a safety, like I just did one with Dell Children's Hospital, and it was a safety event, and I don't know how, it was in Kyle, Texas. I can't tell you how many families I talked to, but how do you count the person that you talk to one person and you give them the message, and then they might talk to 3 or 4 other people? And so to be able to measure that is very difficult to do. I guess, I can tell you, again, at that event, it wasn't huge, but we handed out over 75 gun locks at that event. So sometimes for me could be measuring how many gun locks I can hand out at an event.
I can make one 15-second comment.
Yeah,
so I'll speak again to Dr. Levine's comment, which is, when the mayor was talking about how we're only 1% above or 1% below where we were last year, and at the beginning of the year we were much higher. I think that's commendable, but also everything needs to be taken in context. We're like Dr. Levine mentioned, we're currently in an uptick phase. We don't know how long this is going to go, and just like everyone tries to predict the economy and they're always wrong, I think we're going to end up in the same situation with this, and sometimes we have to give ourselves a little bit, from a statistical standpoint, a little bit of forgiveness and a little bit of context whenever we try to evaluate whether an intervention is working from a top-down viewpoint, when you're talking about a whole city of Houston, which is a gigantic place, or a state of Texas, or a city of Austin. I think a small measure of humility is probably a good idea when we go forward over the next few years.
And probably a lot of time and continued careful study and outreach. I think that this is complicated, and your studies and your outreach demonstrate that working together we can learn a lot. So with that, I think we're out of time. I want to thank this wonderful panel to kick us off this morning again for your work, and we are going to a coffee break now. I think we're back at 10:20.